Hi everyone, my name is Dana M. Bryant and I am a speech language pathologist who specializes in neurological rehabilitation. Day in and day out, I help assess and treat people who have had neurological impairments, different things that have happened to their brain that has changed the way that they eat, they speak, or that they think. Oftentimes people talk about what to expect in the very beginning of therapy or maybe the assessment phase, but today I want to talk to you a little bit about what happens after the assessment. So let's say you have went to a speech language pathologist for an evaluation, you filled out all the paperwork, you have done all the testing, answered all the questions, she or he has explained the results. Now what? Every speech language pathologist does things a little bit differently, but overall, what you might expect is the SLP will get a little bit more information, right? So that you all can develop goals that will meet your day-to-day needs. So these goals can vary anywhere from being able to say something, being able to remember something, eat something, but the goals need to be very individualized. They need to be measurable. They need to be specific. That's something that you all really need to take time and collaborate on, is the goals. And the SLP can't do it on their own. They need you. This is your life. These are your goals. They are just there to support you. Another thing that an SLP might do is begin to figure out what kind of therapy activities, what kind of intervention would be most appropriate for you. So they need your help here too, because you're going to need to explain to them your day-to-day demands. You're going to need to explain to them what's most valuable, what's most important to you. And then they can start to set up activities and different types of scenarios, or go through certain trials with you that are similar to what you want to get back to doing or what you want to get better at. Again, every SLP has a different style. So this may not be the exact thing that happens right after your assessment, but it's going to be something very similar. We as SLPs don't target activities, but we use activities to help us target skills. So the activity could change from session to session, but we're helping you target a skill that you need that can be used and transferred across different settings, different scenarios, different activities. Join me for part 2 of this mini series, where I go into detail about how do I know if I'm getting better? I've been in therapy. How do I know I'm getting better? I can't wait to see you then. Bye.